Hello, it's Julie, and I had gone through the first leadership assignment, and I had some feedback, and Chris asked me to make a video of it instead of just listing, because I thought maybe that would be a little bit easier, kind of like a conversation instead of just a list. So here we go. First of all, I think it looks great. I think that we want to make things representative of situations that are accurate to life. It's very important in simulation, as we all know. We want to make sure that the simulations are as real as possible and those experiences are as real as possible, so the students feel like they're actually performing the tasks and not just pretending to do it. And I do think we accomplish this with the setting and how the assignment is presented. So I think these great visuals here when we get started are going to really put them in the right mindset to get started and to actually make this a very real experience. My first question came up when we got to this screen when we meet Preceptor Angela. I'm just not sure why the students are getting tablets to keep track of the patient information. I understand that in the hospitals they have a computer or some way of keeping track of all the protected health information, but I just feel like the iPad isn't the best method. It seems like more of a vector for me because that will be carried from room to room and set down and brought to a different room, and it just seems like that would be a breeding ground for cross-contamination between patients and just sharing of germs. So if we want to use that, I would suggest maybe we use the computer on wheels or the cow carts that don't get set down in the patient's rooms. They either get wheeled in or stay in the hallway, or maybe if we do want to use the iPads, we make it very clear that it does stay outside of the room in a specific place in the nurse's station. And truly, my other question really on this was maybe it's going to be used more in assignments once they're in the other assignments once they're created, but I really didn't see that it was used in this scenario. So maybe the scenario is not just developed enough for me to understand it, but I'm just not sure we need to introduce it because I feel like we'll get a lot of faculty questions on that. And then my other question regarding the tablet or even the computers is there's protected health information on that, and are we going to have them simulate opening it using a PIN number or their email address or whatever, because that is the way that they would do it in the hospital. So I don't know if we wanted to address that or not, but I thought I would bring it up because that was one of my initial thoughts once I saw the tablets. All right, once we got into the patient's room, I felt like there was just a lot of clicking, like begin handoff, submit, and then I don't even get to use our conversation engine to begin and introduce myself. It's just sort of done for me. So I thought that maybe we could kind of have it be more realistic to achieve that, not just pretending or not just clicking through kind of thing. If we were going to be able to use the conversation engine or even speech to text or whatever, in order to make this a little bit more realistic through all of the clicking. When we got to this part of the SBAR handoff for the nursing report, I just feel like if we're going to ask them to prioritize between the two patients, I think it's pretty important that we add a little bit more robust information to the background section. I do think it's important that it is mentioned that appendicitis has been ruled out for this patient. Right lower quadrant pain is often indicative of appendicitis, which should be an emergency. And if you're going to ask the students to prioritize between the two patients, I do think it's important that we at least add that information for them so they can take that emergency off the top of their list. Along those same lines, here in the middle, it says he has no significant past medical history. But I think we might want to add some of the pertinent negatives in there. At this time, no fevers, bowel changes, dysuria, frequency, testicular pain, hematuria, flank pain, nausea, vomiting, etc. Again, this is just information that's necessary for the students to help them prioritize. I don't think that we can really give them too much information there. And I think that those are the kinds of things that if I was getting report from Ben, I would ask those types of questions just to make sure that I had a complete understanding of what is going on with a patient before we move on to the next one. Once I got to this section, what I noticed was that the nurse says, I recommend that you monitor Mr. Haddad's intake and output. And that's just not something that nurses should or really would be saying. Those recommendations, like strict intake and output, those are orders that are followed from, a medical order, the doctor's orders. I understand that this is the recommendation portion of the SBAR handoff, but I do think we can do better with the language to make it feel more official. We can instead just be reporting that. We can say, what the intake and output was for Ben's shift, so that, and we can even calculate the deficit. I think we can do a little bit better there for the handoff portion, just to make it feel more authentic, because a nurse really wouldn't say, I recommend that you monitor. That would be an order in the chart. And if we could take a look in our chart, maybe we would see that order over here. I'm not sure. But yeah, I do think we could do a little bit better with that language. When I got to this section with Mr. Patel, and it said, find the missing piece of information, and it is Mr. Patel's provider, I really like that part about adding the provider's name to the situation portion of the handoff. I think this is an important and often missed piece of information in communication between nurses, and it's a great learning point. So I really, when I got there, I was really excited to see that that was a part of it. I really like the setup of this. Moving on to the next section, home medications. That's something that's so important, as well as, finding the missing piece of information in the blood glucose. So I really like the way that this is set up. Once I started digging in and taking a look through the orders and going through the scenario with Mr. Patel, my question was that Mr. Patel has an IV. He's getting half normal saline at a rate of 10 an hour. Which turns out to be low, but he's also he has promethazine or Phenergan ordered, and that is going to be given intramuscular, which means we're going to give him a shot every 4 hours, basically, because he's been so nauseated. And Phenergan, I used to give this a lot when I was working on the floor. It is able to be intravenous. So if he does have an IV, which he does, then I would advocate as his nurse that he be given that through the IV as an infusion, as opposed to sticking him every couple of hours when he's nauseated. That's not going to be great, and the patient may be less likely to ask for the nausea medication because they don't want the needle stuck in their muscles. So I don't know, maybe we can keep it and make that a learning point and have the nurse be the patient's advocate. But if he were my patient, I would absolutely want that to be changed from IM to IV for his comfort. And really, I do think it would be more effective because he would ask for it more frequently. So just my 2 cents on the route of administration for the Phenergan. I also found some contradictory sort of answers. If you ask Mr. Patel how he's feeling, he'll tell you he's not great because he just threw up. But then if you ask him when the last time he threw up, he will tell you it was 2 days ago. So just a few little things that I'm sure we're going to work through with the conversation, but just sort of what I noticed when I had talked to him a little bit. I just asked him, while I was on pause, how are you feeling? Not great. I keep throwing up. And then when is the last time you threw up? Days ago, about 2 days, I think, when I started throwing up. So I felt like that was a little contradictory. Again, just a little bit nitpicky with the language in the time has passed section. On the second screen here, it just says the labs you sent are back with his latest blood sugar numbers. And that's just it just doesn't sound all that great. I think all we need to say is the labs you sent her back, and the blood sugar is still high. Blood sugar numbers isn't really, the kind of language that would be communicated on the nursing floor. Overall, again, I think this is a really, really solid first assignment. I like all the rationale and really going through and the SBAR communication and hitting on all of those points and giving a lot of the rationale. It's definitely very basic, but I think it's a great way to start and introduce the concept of prioritizing patients. I'm really interested to see future assignments, and I'm sure they will build on each other and become more complex and have different levels of patient care, just as the floor assignments would be. That was just what I got when I went through this the first few times. So please let me know if you have any questions at all. Thanks.